Well, good afternoon, everyone. Thank you again for joining us to this week's New Hampshire COVID-19 Zoom Alliance meeting. Today is the 27th of April. Again, our mission for anyone who's new is to promote vaccine confidence, support accurate and consistent vaccine messaging, and foster coordination of the vaccines allocation in the state. We do that by promoting buy-in to increase immunization rates, most importantly, to act as a force multiplier to support the COVID vaccine communications allocation plans for the state, counter misinformation when necessary, and foster use of New Hampshire's immunization information program. So just we've had a number of requests, so we're just putting this up there. You can find this information on the New Hampshire Medical Society's webpage under news blogs for each of these dates, and including legal issues that are in requiring or incentivizing COVID vaccinations, the transitioning from a state-run to a private vaccine allocation process. And last week we had Dr. Beth Daly, Alok Patra, and T.W. Hall talk about implementing the New Hampshire Immunization System, or the NHIIS. Next slide, please. As we did at the end of our last meeting, I just wanted to send out to you the opportunity to join a sign-on letter that has the following objectives for continued mask wearing. And essentially, the intent here is to promote individuals, communities, and schools and businesses to follow CDC and DPHS guidelines to highlight the efficacy of mask wearing in slowing the transmission of COVID in New Hampshire. And to do this until the following measures are completed. One, community-wide immunity of at least 70%, and two, essentially reaching minimal community transmission, either less than 50 infections per 100,000 for over a 14-day period, or and along with the 7-day PCR positivity rate for less than 5%. We also say that other prevention measures should continue to be in place. To date, we've received 30 organizations who signed on to that statement. If you're interested in signing on or like a copy of the statement and the signers, please contact me at my email address, jamespotter@nhms.org, or you can call me at our office number. Next slide, please. So just some follow-up from last week's discussion with Dr. Daly, Alok, and TW about the NHIIS, and here are the links to the website for that information. Next slide. So takeaways from that discussion are there's a new parental consent form for incorporated into Avini for anyone under 18 registering for the vaccine that you have to complete by the parent. Second, the 7-day reporting requirements have been waived for the initial implementation period. And there is a Division of Public Health memo on that. This means clinics don't need to report to the NHIIS or provide dose-to-dose accountability until they enter a new vaccine order. And one, it only applies to state vaccines, but your order will only be on a dose-to-dose basis that you have documented to that date. Also, a couple other things, as discussed at the meeting, the HL7 messaging code was released yesterday to facilities who signed a provider agreement and indicated they had the capability to do the HL7 integration. If you have not received that, then you can go to the NHIIS email and indicate that you would like that code. The step-by-step process document is to be released soon, but in the meantime, you can also review what's been there on the IIS HL7 website, which is the National HL7 2.5.1 implementation guide, and then the local Delta guide that goes along with it. Also, as we repeatedly say, we are moving likely over the month of May in various forms from a predominantly state-driven allocation process for the COVID vaccine to a private one. So in preparing for that process, please have your staff signed up and trained for the IIS. To operationalize the vaccine administration for your various practice locations, develop protocols on how to reduce the vaccine waste, storage, and handling required, as well as data entry requirements, and how protocols and workflows can help achieve health equity to address vaccine ambivalent and vaccine hesitant populations. Also, you'll want to develop some patient vaccine information. We have some FAQs that have been developed that are brandable that you can use to this extent, and they are being updated on a continual basis. Now, here's the meat of today's discussions, and you might want to write these questions down. They will be available later today, but we think that this is kind of the important meat of this particular meeting. There will be federal funding available in the near term to assist with the vaccine allocation transition. And there will likely be 3 distributions of these federal funds through the state, one to hospitals, the second to federally qualified health centers, and the third to those primary care pediatric practices who don't fall into those or other practices that would like to distribute COVID vaccine over the summer and into the earlier fall, and likely to be doing the boosters as we get into the fall. So here are a couple of things that you'll want to, you'll need to think about. What do you need and what are the costs to support implementing the NHIIS system, including training needs, IT support, and any enhancements that you might need for your EMR system, both in-house and external vendors. Any data interface HL7 needs, and I will just remind the audience that and Dr. Daly said that essentially they're only going to do manual entry and HL7. So this may fundamentally change the way you think about your EMR system and its need for enhancements. Those workflow changes and any staff costs associated with the initial and double data entry requirements. And I'll just ask that for any of these, if you are one of those non-hospital, non-FHQ sites, please send this information. We are helping aggregate some estimates that cost to go out to these type of facilities and practices. Second, the needs in the transition. What are the additional equipment and costs needed to support vaccine administration process for staff? Principally vaccine storage or refrigeration. Think about the vaccine refrigeration needs for the mRNA vaccines. And I think you should not think about this as just in time kind of service from the state. It would probably be more periodic. I don't know what periodic means, but I don't think you can say, well, we're going to do this on a daily basis or maybe not even on a weekly basis. So you'll have to have capabilities, and also think about this in the multiple dose administration that many of these vaccines come, and how you would handle those situations. The intent here is to be able to safely store vaccine, but also not to waste vaccine in your planning. So also ancillary supplies and waste management that you may need to and not have in place at this point. And then the third aspect of this is what equipment needs you'll have for any kind of mobile outreach into the local community to achieve health equity and reach populations that wouldn't necessarily come into your healthcare setting. So again, this would be more of a desirable activity, but this is something that look at those questions. They'll be available. But if you have these needs, please send them, email them into me to help our assessment and estimates. If you have cost estimates on any of these, particularly refrigeration, please include those. Please include what you anticipate would be your staffing needs as we move forward here. So, excuse me for a second.
This is a call from a debt collector. Please call 8.
Anyway, excuse me for that. I do apologize. So Brian has put up some of the links, and again, please email me for that information. We have one question in the queue right now, and if you have any more, I was at the Dover Fix site Saturday as a vaccinator. About a dozen people on the shift had gone to Walgreens for their first shot, but couldn't get their second shot there. Seems only a highly motivated person will know where to go else, and we are losing people for their second shot. Are we losing people for their second shot? And the answer is yes. Within the state, I think Dr. Daly mentioned in a recent interview that we're losing about 2% to second doses. And so those people, if they didn't go to the same site, would have to go back into Vinny and get another. But there are ample places and vaccine appointments within Vinny, particularly over this next month, that will be opening up for that purpose. However, we're doing appreciably better. 2% may seem a lot, but the national average is about 8% right now. So we're doing better than not, but again, we don't want to have individuals thinking that the one dose is enough development of the antibodies at this time. Through the clearance that was developed for the protocols for the mRNA vaccines, it is a 2-dose regimen to get to the necessary antibody levels. So again, if you have needs for essentially this vaccine transition, please send those in to me, and that will help our assessment as we move forward. And if you're in another setting that wouldn't be that one that we'd be necessarily handling or potentially handling, then we'll make sure that that information gets to the FQHCs or the hospitals as they go forward. So quick meeting today. That's all we have. Hopefully we'll have some new updated information next week on the transition. We have one more question here. Is there a plan for vaccine sharing if a facility has a need for vaccines but can't guarantee 5 to 10 recipients at one time? Not that, but I don't know if there's anything that's formally being developed, but that might be something for you to think about with facilities that are nearby you. Could you develop a plan where you're sharing those vaccine doses on a particular day? What I've heard from some facilities is while they'll be trying to do point of care when they can grab somebody, they also may try to put vaccine distribution on certain days of the week so that they can aggregate that, and that is more of a thrust during particular days. Again, we're dealing with hesitant populations probably at this point, and so that is a little bit of a challenge from an operational level where you can have, you know, I think that they're working up to plus 10 doses on the mRNA at this point in time that you can get from any one vial. So there may be some changes as we move forward, but I don't think that the manufacturers are necessarily going to change their mode. So I would look and see if there are any vendors in the area that you could collaborate in that kind of initiative. I wish I had more information, but that's all I know thus far. But a good question, and we'll make sure that that is passed on to the Division of Public Health Services for consideration as they develop more specific guidance. So, any more questions? Okay. Again, thank you for joining us today. I'll give you back the gift of time today, a little bit more than a half hour than we normally go. Be ready next week because I think we will look in the month of May to be the big transition month from public to private allocation process. Again, thank you for joining us as always, and we'll look forward to seeing you next week, Tuesday, May the 4th. Be with you. Take care, everyone. Bye-bye.